I tore my first ACL in the middle of a field hockey game, and I twisted or rotated wrong and I just fell. And then I freaked out because I was trying to stand back up, but I just couldn't stand up. The trainer got me into the training room and he checked me out. And this whole time I was freaking out. I was thinking like, I hope it's just a strain. I hope it's nothing serious. I scheduled a scan with Dr. Burnett for the next day.
She was having difficulties with pain, limping, swelling of her knee. And then when I seen and examined her, got some x-rays, I was questionable if she injured a ligament in her knee, which ultimately she did, confirmed diagnosis on an MRI. You can't actually repair an ACL. You actually have to make a new one, do a reconstruction. To reconstruct someone's ACL, there's different graft options, the graft being the tissue that you use to make the new ACL. There's synthetics, there's also cadaveric tissue, which is donor tissue, and then in fact, there is the person's own tissue. So in Haymen's case, we elected to use her own tissue.
Going into surgery, I was freaking out because I've never had surgery before, and he told me exactly what was going to happen and what he was going to do, and he calmed my nerves, and he was with me throughout the whole procedure, and it was a great help.
The surgery is such that it's a day procedure. You come in and go home the same day. At the time of the ACL reconstruction, all the other structures of the knee are evaluated. It's basically an arthroscopic procedure. It's fairly minimally invasive. The goal of surgery is to reestablish their functional level and get them back to their activities that they wanted to do, brace-free, so they don't have the encumbrance of a brace or any restrictions on them.
After the surgery, I was on the couch for a week and I couldn't get up or anything. I had to use crutches and I had to use a wheelchair. And it took me about a month to be able to fully feel free, bend my knees and walking regularly without the limp. I did physical therapy before the surgery and after, and I think doing it before helped a lot just so I felt comfortable and I didn't feel as weak going into the surgery. If I had to go back and decide if I could have the injury again, I wouldn't be opposed to it because it actually shaped me into the person I am today. I'm stronger physically and emotionally, and it's actually a good experience in my opinion.